The government has introduced a raft of new stringent measures aimed at battling the third wave of COVID-19 infections. President Uhuru Kenyatta, in his 14th address on COVID-19, spelled out 18 measures in place to contain the spread of the virus. Here are the details of the new measures. Well, here you are. These, as I told you, were the new measures that were outlined today by President Uhuru Kenyatta. From now going forward for the next 30 days, the ban on all political gatherings for the next 30 days takes effect midnight today. Extension of the nationwide curfew for another 6 days, which means that all the political meetings that we have been saying have now been banned and made illegal. And President Kenyatta was very firm on this, urging the Ministry of Interior together with the Kenya Police Service to ensure this ban is enforced. Extension of directive for bars and restaurants to close by 9 p.m. That is the current situation. And limiting number of people attending funerals, stroke weddings to 100. Of course, this is very bad news for anybody who was planning to get married this weekend, because it means that you have to cut down on the number of attendees. The barriers to take place within 72 hours of death. Again, this is likely to be very interesting going forward, because you know for sure here in Africa we like to celebrate the deaths of our loved ones with long ceremonies. The public health safety protocols will continue as usual. Worship places to accommodate only 1/3 of the capacity, which means that if your church or mosque or which is the other one, or temple, accommodates 100 people, only 30 are permitted by law. Border health security to be enhanced as well to track any new cases of COVID-19, you know, from penetrating into our country. Those are some of the issues, as well as protocols for public service transport to be revised, and Transport CS James Macharia, together with his health counterpart Mutahi Kagwe, have been directed to ensure that they develop new protocols on transport. Establishment of an intergovernmental committee on COVID-19. You remember very well that the former chair of COG, Wycliffe Oparanya, who happens to be the governor of Kakamega, has already relinquished his position to the governor of Embu, Honorable Martin Wambora. So the committee has been reconstituted and they're expected to start work immediately. Let's go next. Oh yeah, and something else very interesting about this intergovernmental committee is that they're supposed now to start meeting on a weekly basis, whereby they're expected to update the nation on the new measures that are taking place to help the spread, or to help curb the spread of COVID-19 in the country, as well as the new measures being put in place to ensure that the country goes back to normal. Achienga Catherine is my co-host. She's on the other end. Achienga.
Very stringent measures indeed.
Oh yeah.
It means we have to change our lifestyles again.
Absolutely, and the beauty of it is that somehow we have gotten used to these new measures, because they have been with us for the last almost 11 months.
Yes, 10 months.
10 months actually. So, which means that somehow this is our new normal, if I'm allowed to say so.
Yeah, it means we can't throw out the masks just yet.
Absolutely.
All right,
Please.
Let's now continue focusing on other measures that were announced by President Uhuru Kenyatta earlier today. And the government has now heeded to rising calls to introduce stiffer measures in the wake of a spike in new COVID-19 infections. Now, President Uhuru Kenyatta says the decision to impose restrictions is guided by a need to preserve the sanctity of life, as opposed to salvaging the economy, which can be rebuilt. Nancy Okware takes a look at the implications of the latest directives.
The government has issued new directives in a bid to tame the increase in cases of COVID-19, whose infection rate has risen from 2% in January to 13% in March. President Kenyatta, in his address, said the new measures were aimed at ensuring a drop in new infections, and the changes are a delicate balance to ensure the social-economic landscape is not greatly affected.
Exemption on the application of curfew is hereby granted to essential service providers, factories working on 2 shifts, construction sites, all these are allowed to operate their night shifts.
With some players in the industry having decried the prolonged measures that have hurt businesses, the head of state says that the measures have had a positive impact in protecting the sanctity of life.
The cost of this bold decision to our economy was hefty. Nevertheless, the profit of the swift policy action is immeasurable in terms of the human lives saved.
The new measures reducing the number of people attending funerals, cremations and weddings and for burials to take place within 72 hours are likely to reawaken concerns over cultural practices and financial capability.
Sio kwa sababu ya kuzuia wenzetu kumon wale ambao wamepoteza, lakini ni kuzuia wengine wasiende matanga, wajipate kwa shida, na hao pia tuwapoteze juu ya wale ambao walienda kuzika.
Reforms in the public service transport sector are also in the offing.
The Cabinet Secretary for Transport, jointly with the Cabinet Secretary for Health, are directed to develop revised protocols for public transport in consultation with all stakeholders in the transport sector.
And to ensure adherence of all guidelines announced, President Kenyatta has directed that an intergovernmental coordination framework be established in all the 47 counties to spearhead implementation of the revised containment measures. Chair of the Council of Governors, Martin Wambora, welcomed the directives urging Kenyans to remain vigilant.
Tukianza na hii mambo ya corona, kwa sababu inaangamiza watu wetu zaidi, tutashirikiana pamoja ndivyo watu wetu wapone na escape hii mambo ya COVID.
Nancy Okware, Channel 1 News.
Now, Kenya has recorded 750 new COVID-19 cases out of 6,264 samples that were tested in the last 24 hours. Now, the total caseload in the country stands at 111,935. The figures represent a 12% infection rate. Now, in the latest figures released by the Ministry of Health, 215 patients have recovered from the disease, 122 from the home-based isolation care, while 93 are from various facilities. 2 more patients have, however, succumbed to the disease, pushing the total number of fatalities to 1,901. Currently, there are 632 patients who are admitted in various health facilities countrywide, while 1,912 patients are on home-based isolation and care. 96 patients are in the intensive care unit. Those are the latest figures by the Ministry of Health regarding the status of COVID-19 infections in the country.